Hello, everyone. Thank you all for joining us today as we recognize National Family Caregivers Month with a special webinar, The Power of Storytelling, Shaping Caregiving Narratives and Preventing Abuse. I'm Lori Mars, Director of the National Center on Elder Abuse. The National Center on Elder Abuse is supported by the Administration for Community Living and housed at the Keck School of Medicine of USC. We provide the latest information and resources on research, training, education, and best practices on intervention and elder mistreatment. Our goal is to improve the national response to elder abuse through our comprehensive data repository, the synthesis and dissemination of evidence-based practices, and state and national collaborations to support elder rights and justice. We recognize that as a society and as individuals, we must increase our efforts to ensure that all older adults are treated with dignity and respect, free from abuse, neglect, and exploitation. Today, we'll discuss the power of storytelling to explore and elevate caregiving relationships, with a specific focus on caregiving in the media. You'll hear from an outstanding panel of experts, Dr. Laura Mosqueda, MT Connolly, Dr. Donna Benton, and Kate Folb. They'll delve into why caregiving stories and media portrayals matter, how they influence public perceptions, and how they can be used to increase awareness of resources for safe and supportive caregiving. Before we begin, I'd like to go over a few housekeeping matters. All attendees will enter the meeting in listen-only mode. Please utilize the Q&A function to submit questions or comments to panelists. To enable the live transcript feature, click the CC button on your screen. The recording and presentation materials will be made available through the National Center on Elder Abuse. And at the end of today's webinar, you'll receive a survey link. Please complete the survey and provide your feedback. Your comments will help inform future NCEA webinars. The views expressed by the presenters today are theirs alone and do not represent those of the Administration for Community Living or the National Center on Elder Abuse. I'm now going to turn to MT Connolly to introduce this topic and lay the foundation for the panel discussion. MT is a leading national expert on elder justice, a MacArthur Genius Grant awardee, and author of the 2023 book, The Measure of Our Age, Navigating Care, Safety, Money, and Meaning in Later Life. She was the architect of the Federal Elder Justice Act and founder of the Department of Justice's Elder Justice Initiative. MT is also co-designer of the community-based RISE model, intended to introduce holistic, hopeful, and effective ways to empower older adults, reduce harms, and promote elder justice. Welcome, MT.
Thanks so much, Lori. Can you hear me okay?
Yes.
Okay, great. Thanks so much for having me on a topic that is near and dear to my heart. I learned about the power of storytelling really coming in through the door of the law. I am a recovering lawyer, and early in my career looked to prosecution of elder abuse and legislation like the Elder Justice Act for solutions to big social problems. And what I learned is that those efforts didn't really move the needle as much as I had hoped, which led me to think that something deeper was going on that I didn't really understand. And so I set about writing and telling stories, and more important, listening to stories about what was going on with aging for a really broad realm of people. And really tried to synthesize those stories into a book that that taught me a lot. And one of the things, probably the most important part of the research for me, was about the last chapter, which is in how we make meaning of aging and of life. And storytelling is a core component. So what I want to just outline here today is essentially 4 different ways to think about storytelling that relate to caregiving. First, stories shape how we make sense and meaning of our existence. We are what the anthropologists call homo narrans. We are narrating humans, all these random things happen to us throughout a life, and how we make sense of that of who am I and why am I here has to do with how we tell stories about ourselves. And our brains for millennia have been wired for stories. That stories are how we exchange information with other human beings and how we record information and pass it along from one generation to the next. They're also central for how we communicate and connect with other people. And it's really this sacred act of listening to other people's stories and telling them ours, which creates then a new shared story. So that and caregiving, how we care for one another, is right at the core of who we are as human beings. A second way to think about storytelling is that of bearing witness, essentially how we shape culture. Because one of the things that is not a new idea on this webinar is that caregiving has been largely invisible. And part of that is that haven't told or listened to the stories of caregivers. And so, in writing my book, I learned about the stories of dozens of caregivers, including Laura Mosqueda, from whom you're going to hear next. Laura's mom had advanced Alzheimer's, and she and her father were the primary caregivers for her mother. And I wanted to tell Laura's story in the book as a way of bearing witness, her bearing witness, and really saying that even for somebody who should have all the expertise in the world, for whom caregiving should be like a cakewalk, it was incredibly hard. And so Laura's story with her mom takes us through um, caring at home, a fall, being in the hospital, being in rehab in a nursing home, and then back with caregivers at home. And so that was one part of it, just showing people what that journey of caregiving can look like. Another aspect of the bearing witness for me was that Laura's views about caregiving create a permission structure, I think, for other caregivers to really take care of themselves. We can't be perfect caregivers often. And the line that we, used was that good enough is good enough. The third aspect of caregiving that I think about storytelling that's relevant to this conversation is that storytelling can reveal what was previously invisible or unknown. And so that is the kinds of stories that we see perhaps in journalism or in science. And one example of this that I wrote about was a bruising study. So Laura and her colleagues looked at bruises in older people. And sort of surprisingly, we didn't really know how to tell the difference between a bruise that was innocuous versus a bruise that was suspicious. So by going through the process of interviewing a lot of older people, documenting these bruises, and then analyzing them, that was a scientific study that then I hope to translate into a story of how we as human beings and as professionals in the field and as family members and as consumers can tell the difference, for example, between what is probably an innocuous bruise versus one that is much more suspicious. Another example of that is what's the Coach study, which was done by USC colleagues in connection with Kaiser, where they really helped caregivers of older people with chronic disease, including Alzheimer's, with caregiving. And so they studied the differences between the group of caregivers, family caregivers who had received assistance or the coach intervention versus those who did not. And what they found was just sort of astonishing. It's a small study and I hope it'll be replicated, but essentially that people who had the benefit of the support, there were zero allegations of elder abuse in the intervention or treatment group versus about 20% plus minus in the control group. That's really an amazing piece of information for us, and it's an important story to tell that when we assist caregivers, we can reduce elder abuse. So that is a way, I think, of using stories to reveal what was previously unknown. And the fourth aspect of caregiving, keep confusing, of storytelling that we need to think about is storytelling to drive action, storytelling as a tactical tool. And in this is a tool of both people who are trying to work for social or cultural change and also people who are propagandists, right? How do you tell stories that move the needle on the way that the body politic thinks about things or that makers think about things? Um, so, a couple things when we think about caregiving is what are the stories that we want to illuminate to show the importance of caregiving? The incredible breadth of it, that there are more than 50 million people who are family caregivers for adults 50 and older. The economic infrastructure, both as a nation, that it's a $500 billion industry, essentially, I mean, that it's a $500 billion in benefit, but also a $500 billion in cost to caregivers. We also want to personalize. We want stories that personalize caregiving, that show how universal it is, that it's almost everybody's family and it's almost all of our future selves that should be caring about caregiving. And then how do we test the impact of the stories that we tell about caregiving? Sometimes also referred to as message testing. So there we need to really exercise some rigor. So what is the goal of the story that we're trying to tell? Who is the intended audience? What do you want those people to do? And what message will get them to do what you want them to do? And so those are really important questions to ask when we're using stories to try to drive social change, whether it's a policy or a new law or support, or increasing the visibility of caregiving in the culture. And there we need to really do some testing and have what's called message discipline. So, in sum, um, stories are incredibly powerful to our consciousness, our own individual consciousness, to how we shape culture, to how we shape our understanding and reveal what was previously unseen, and then to driving action. There's a saying that culture is upstream from law and policy, and stories are upstream from culture. And they're critical to improving the well-being of caregivers and those for whom caregivers provide care. So with that, I'll leave it and look forward to the conversation.
Thank you so much, MT, for that terrific introduction. And now I'd like to invite other panelists to join the conversation and to briefly introduce yourself. So I'll start with Dr. Mosqueda to please introduce yourself.
Hi, I'm Laura Mosqueda. I'm a professor of family medicine and geriatrics at the Keck School of Medicine of the University of Southern California, and a senior advisor to the National Center on Elder Abuse and a volunteer long-term care ombudsman.
Thank you. Dr. Benton.
Hi, I'm Donna Benton. I'm with the USC Leonard Davis School of Gerontology. I'm also the director of the Family Caregiver Support Center, where we're really committed to providing direct care services and also innovative research that help family caregivers manage that psychological strain that's related to caregiving. Because we found that if you help caregivers navigate resources, you can reduce the risk for elder mistreatment.
Thank you so much. And Kate.
Hi, everyone. I'm Kate Folb. I'm director of Hollywood Health and Society, which is a program of the USC Annenberg Norman Lear Center. At the Norman Lear Center, we study and we help shape the impact of entertainment storytelling on audiences. I'll leave it there. I have much more to say.
Hey, thank you so much. Well, we're looking forward to an engaging and robust conversation on the issues. And I'd like to invite the audience to please share your questions and comments in the chat as we move forward. So MT laid a perfect foundation for a discussion on caregiving and storytelling. So let's turn now to caregiving portrayals in the media. How is caregiving portrayed in the media?
Well, I guess that's for me. The media person. I'm heartened to say that in just very recent years, just in the last, I would say 5 to 7 years, we've started to see an uptick in depictions of caregiving on entertainment, TV, and in movies. In fact, I was just mentioning before we got on this call that we do an award every year, the Norman Lear Awards, where we honor television storytelling on important health and safety issues. And we had three this year that had significant caregiving storytelling themes throughout those shows. And just for the audience's sake, The Pit, if you haven't seen it, it's a medical show that takes place in Pittsburgh in an ER, starring Noah Wiley, who won the Emmy for it this year. A show called Shrinking, which has to do with mental health, but there was a very strong caregiving storyline. And also a show called Dying for Sex, which also was Emmy nominated. So they're not just obscure shows, that nobody's watching. These are top shows that are winning awards and that garner millions and millions of viewers. However, we can always do more. There's always room for more. And just because one show does that sort of storyline doesn't mean that everybody else is off the hook, because it's critical that we see more of this depicted.
Thank you, Kate. So we are seeing more depictions, but is there anything that's missing from those depictions across media platforms?
Yes, I would say that we're seeing, which is a good thing, we're seeing a lot of, I wouldn't say a lot, but we're seeing an uptick in stories of caregiver burnout, things like that are really important to show. And we're showing, the sandwich generation, people who are caring for kids as well as their parents, those kinds of stories. But what we haven't seen a lot of, and Lori, you and I have talked about this, is elder abuse. We've seen some storylines around financial scams with older adults and those kinds of things, but I'm pained to think of a storyline that has dealt with elder abuse in recent years. I can go back 20, 30 years and think of maybe one. So there's a big gap there that we still need to fill.
Do any of the other panelists want to comment on that gap and perhaps remedying that?
Well, I'll continue talking.
Well,
I actually asked that question to some filmmakers and network executives just since we've been talking about it, and the answer I get pretty much is fear. That they don't want it to turn into abuse porn. They don't want it to be sensationalized. They don't want it to be triggering. And they also probably have some of their own biases in there about what would be entertainment. So I think it's important, and I hope that we'll be able at Hollywood Health and Society that we'll be able to work with storytellers and bring in experts like those on the panel today to talk to writers on how to nuance these kinds of stories in a way that would be effective for audiences to consume and then think about in their own lives.
Yeah, and I want to
Yeah.
pick up on that. So go ahead, MT.
Oh, well, I experienced the same thing in trying to publish my book, that publishers also are worried about the subject. And I think, we watch The Wire, we watch all kinds of shows that have very complex and pretty dark storylines. But I think one of the reasons, at least that I've come to for the reluctance to tell these stories, is that it has to do with us or our future selves. I mean, it's easier for people to digest when the problem is a them problem, but if it's an us problem, then people are scared, and really it doesn't qualify as entertainment anymore.
Yeah, and I was going to latch on to the word you used, nuance, Kate. I'll tell you what my fear is about portraying these stories is that it will be sort of elder abuse porn. It'll just go to the sort of lowest common denominator, when the reality is the vast majority of elder abuse doesn't rise to that level of violence. Sometimes it does, or sexual assault or whatever it might be, that's sort of the worst of the worst. And that a lot of it is happening by people who were not trying to prosecute or, everybody just needs help. It doesn't justify the older adult getting abused, of course, in any way. But I think we're beginning to recognize when we can see the signs that this is a pattern headed in that direction. And I think there's a lot of opportunity to bring in elder abuse from a prevention and or early detection kind of a thing, like a story that shows that this is going down the wrong road and what can be done to help and support and prevent something worse from happening.
Yeah.
I'm intrigued by the bruising study already, and I want to take that to writers because that is a perfect sort of inroad into some of these medical investigation kinds of shows, where they could follow that down and then nip something in the bud before it gets out of hand. So, I mean, these kinds of studies and all are very, very useful for me when I go to TV storytellers with a subject like this that they're kind of afraid to tackle.
Yeah, and we have real life stories of how things got missed in the emergency room or in the physician's office because older adults bruise easily. And so, there's lots of real life stories to base something on.
Yeah, I have a filing cabinet full of outtakes, Kate, on these kinds of stories. And that's actually the bruising study in particular has some hilarious stories that would provide levity along with the seriousness so
Love it. Love it.
Yeah.
Bring it on.
Yeah. I to continue what you guys are saying, one of the things when I think about caregivers, when they're trying to portray what's going on with a family, is that, as Laura stated, it doesn't have to rise to the physical sexual abuse, but what we'll see is, like, I remember a set of educational videos on how to recognize abuse in your community. And they were showing like a teenager who went over to a friend's house. And while they were there at the house, the grandfather kept saying, "Where's my, I don't know where my stuff is." And then the mother, out of frustration, says, "Look, we have to go out right now. And so I need you to go back to your room and here, take your medicine." And you kind of got the sense that she was giving him too much medicine. And when the friend went with their friend into the grandfather's room, you saw food still left there. It was kind of a very dark room. And you got this sense of he was feeling like something was wrong, but he didn't know, like it just didn't feel respectful. And so I think some of those portraits, that if we can show that some of it is that frustration with how to manage behaviors and care, and you kind of in some way are doing something, but you're just overwhelmed. And so we don't always get those stories, and that we don't have to sensationalize it. It's just showing kind of how things build up, and then you need some education because you don't know what to do.
So, and drawing upon the conversation about perhaps the reluctance to show those stories of elder abuse, why is it that we do see stories about child abuse and intimate partner violence, but we rarely see things about elder abuse?
Well, if you remember, intimate partner violence and child abuse, it took a long time for it to come out of just this was what was done within families. This is, like intimate partner, like that's a private affair. And elder abuse is still that's a private affair of how you're caring for your dad or how you're helping with your mom. And people really see that, so I think it's been years before we really got people to recognize it. It's that private affair is really a societal issue, that people are struggling and drowning with the extra care that's being taken on by families. For many, many years, families have been doing this, but it wasn't as complex as it is today. I mean, now people are being asked to do where somebody was actually used to have a nursing degree, but now, you're at home with all kinds of machines and complicated medication regimens. And so a lot of families are drowning because of this complex care that they're doing. And I think that that's one of the reasons that it's still held back, because families think this is the norm. This is what we're supposed to be doing.
I love that point. And in the few times that I've testified in criminal trials, one of the issues for the jury is that somebody who may have been neglected to death, or it's being prosecuted as a homicide because of they died in a violent way, there's a real concern that the jury just identifies with the caregiver, and because it was just so hard and I was so overwhelmed, and so finding the right balance of empathy and love for what somebody may be going through, and also drawing the line about dignity and respect and just decency, I think really offers a very rich opportunity for portrayals. I mean, we're mostly talking about media, I guess, as television and cinema, but of course there's other media as well, where the nuances that gave back to the word Kate used earlier, I think, can be expressed. And maybe not now, Lori, but I think at some point we need to talk about ageism as well as an underlying factor that that creates some of the problem as well.
Do you want to address that?
I'd like to,
Oh, sorry.
just following up on what Donna said, I think, we've never lived this long as human beings before. And we are living these incredibly long lives without a workforce. We have never figured out the caregiving piece. And it's both the number of people who are living longer lives and also, as you said, the depth of old age, the number of care needs. I mean, we all want to do these following 5 things so that we live to 117, but we really haven't made a plan for what we're going to do when we get there, and need a lot of help. And so we have this weird disconnect. And in one sense, I feel some empathy for us as a culture because we haven't been here before. It is new to have this great a need for caregiving in late life. There's also not the kind of cultural support, like when our kids are in school, there are PTAs, there are social institutions that sort of bring us together so that we have some kind of social support. But with aging, people want to stay at home. People are wildly isolated, both as older people and as caregivers. And so that kind of social support to help one another really doesn't exist in the same sort of way. So I think those are also factors in terms of why it's so important to tell the stories to begin moving these issues more out into the culture, so that people know they're not alone, and creating a forum, more of a forum to talk about them and address them.
We did a study on the show This Is Us, which some of you may have watched, and there was an Alzheimer's thread and caregiving thread around that. And we looked at social media conversations around that show. And it was really interesting because we found that overall the caregiving storyline on This Is Us inspired viewers to share their own caregiving stories and experiences on social media. And it drove a surge in care-related dialogue on places like Twitter/X, and other platforms. So on Reddit, and in fact as well, where they started having much more in-depth conversations. And on Instagram, we saw that about 82% of people that commented around the Alzheimer's storyline on This Is Us were positive. They liked it. They wanted to see more of that kind of storytelling. And of those, 3 in 4 suggested that they had gained a better perspective on caregiving experiences for themselves and for others. So, I mean, these are things that we look at when we look at these storylines. We look at, how they're impacting audiences, what they're causing audiences to do. And I'll just say one other thing about it, with regard to their attitudes and actions. We found that viewers of the This Is Us caregiving storyline were more likely to support increased government funding for home and community-based care services. They were more in support of guaranteed family leave and medical leave for workers who need to take time off to care for someone. And they were also likely to support improved wages and benefits and trainings for those who assist older adults and disabled people. That's just from one TV show. So it not only informs and inspires people in their own lives, but it also can shift policy, and we've seen this with other other topics that I don't want to get into right now, but we've seen how storytelling on TV and in film can change the norm, it can enhance the conversation, and it can also move the needle with regard to policy.
Yeah. And speaking of policy, you mentioned about workplace. There was a storyline in Abbott Elementary where someone took a vacation, but what they were really doing was going to care for a grandmother with Alzheimer's disease, and people had, but she was afraid to tell at her workplace that she had this responsibility. And so being able to say, people are, fearful of losing their jobs, of being embarrassed by having to do caregiving activities, and would rather say, I'm taking a vacation, and have people mad at them for taking a sudden vacation, as opposed to saying, I have to go and help care for a relative. Why should we have shame around something that 1 out of every 4 families is doing every day?
Yeah, Donna, and I think the more we're open and talk about it, the better it is. I know we're talking about more in the media, but also I think the power of storytelling kind of one-on-one, because I, as a physician, sharing just to the extent appropriate, right? You don't want to overshare or become a burden on your patient, but letting people know, I've been in your shoes. I am a caregiver, or I have been a caregiver. In sharing, having that common bond, it was one of I think the first things that MT talked about when she was laying out the foundation for this webinar. It's this sharing this information also helps you become closer and feel safer with each other, and really helps eliminate the shame. Like, this is really hard. I was really hard for me too, and I get it. And I think that's the power of storytelling as well.
Yeah.
Right. And that people are reluctant to call themselves caregivers is true, particularly in some communities also, which is another reason that I, wanted to call out Laura as a character, because I think it's super important for people to see caregiving in action and honor how complicated it is.
Yeah.
So, given the importance of showing these portrayals of caregiving in the media and across platforms, how do we tell a better story about the connection between caregiving and elder abuse?
Well, this might be a good time to talk about ageism and how older adults are depicted in the media, on billboards. I mean, if you walk into any bookstore, you'll find more books on how not to age than on how to age well. And there's only one way to not age. So that should actually be a very short section, but it tends to be a very long section. But it gets back to what MT brought up earlier, fear of aging and really fear of death. Or the other thing right now that's very, I think, prevalent in my age group, I'm 65, is fear of dementia. And so there's a lot of fears related to aging and fears related to the unknown. And I think there's ways to assuage those, to bring them out into the open, and that the media really could provide a very interesting platform for some meaningful conversation. It doesn't have to be a lecture, documentary type of thing, but to weave those into storylines about how older adults are perceived and treated, and how the older adult receives this. I still remember vividly some patients in my office who were just so happy that I spoke directly to them and said to the caregiver who came in with them. And they're like, this is the first time a doctor's talked to me, because I'm in a wheelchair and people just talk to my daughter. That's easy. That kind of stuff is easy to incorporate in, and there's hundreds of examples like that are very easy to incorporate in, that plant the seeds about ageism in our society.
Yeah, I had the honor to be able to work with Norman Lear, who lived to be 101, just passed away a couple of years ago. It's funny because I met him in his 80s. Like he had had a whole life before I met him, and yet I knew him 20 years. It's like it's really crazy. But he was very certainly by the time I met him, he was an older adult, but he was very vibrant and still producing TV shows. And his most recent TV show just dropped on Netflix just a few weeks ago. So, but he used to say, everybody wants to get old. I mean, don't you? I mean, what's the alternative? So he was very much a proponent of this and helped me talk to the networks and the studios and all about this ageism thing. And I was grateful to have him because they'll sit up and listen to him because he knows what he's talking about when it comes to TV storytelling. But even he had trouble. He developed a show that he called Guess Who Died? And it was sort of a throwback to your parents when they were reading the newspaper and they're reading the obits and they're like, oh, guess who died? Uh, but took place in a care home, had top star Holland Taylor and all kinds of fancy celebrities playing the roles. And the network, I mean, he got the pilot made by, I think, NBC, and then they passed on the show. So even someone like Norman Lear was having trouble getting depictions of older adults, on the air. Since then, of course, we've had Grace and Frankie, and we've had a lot of success with other shows. Oh gosh, anyway, there have been several, and we've done a lot to really pound the pavement with the industry, just to depict. Like, not everybody has to be 25 and a fashion model. They can be older, more established characters on your shows, and they can still be vibrant. They're not just the old person in the wheelchair or the granny with the dementia that's the joke. And we have had quite a bit of success in terms of, dare I say the word diversity, but diversity with regard to age on casts and in shows. But we haven't we've gotten that far. Now we have to take the next step and get into more caregiving and, of course, the abuse thing, which we have rarely seen at all.
Yeah, and there's I'm going to use diversity in a different way related to aging, which is the older we are, the more different we become. And truly, heterogeneity is a hallmark of aging. And the opportunity to show, 85, 95-year-olds in all of their glory in different circumstances is really outstanding, from very high functioning, still playing tennis, cognitively intact, etc., to people who may have a dementia, to people who may have a terminal diagnosis or on hospice. But keeping in mind that heterogeneity is a hallmark of aging, I think, could also provide some inspiration for media stories.
Yeah, that's great.
I want to talk about that intersection of elder mistreatment and storytelling. One of the early shows that we don't maybe even think about caregiving was Golden Girls, because she was taking care. She took her mother out of a nursing home so that her mom could, live a better life, and they were doing caregiving as a group. But one thing that was a running joke in the show was the threat of Shady Pines. And Shady Pines, anytime the mother kind of got a little too, a little crazy or started doing crazy things, Dorothy would go, Shady Pines, Mom, Shady Pines. And we all joked about it, but we can think that's kind of like, what if the mom hadn't had the strength to take that as a joke and was very fearful about going back to Shady Pines? But that became an ongoing joke. My ongoing joke about Shady Pines is I actually my daughter, who loves Golden Girls, the different generation, I think it's every generation loves that show. She started using that same joke with me, and I'm pretty much cognitively intact. But I took it and I had a sign made and put it, and it's on my front door that says Shady Pines. So my house is now Shady Pines. So I said, yeah, when you're ready to become my caregiver, I'm already at Shady Pines. So this is how we handle it. My daughter hates me sharing that story, and I'm sure she's not going to be happy again.
Love it. Well, a couple other shows that I now thought of. A show called A Man on the Inside, which stars Ted Danson, and he lives in a care home. And of course, accuracy, okay, that's a whole other thing we can talk about. It's obviously a very fancy care home, but it's still the entire cast pretty much are older adults. And it's not really about, it takes place in a care home and there are issues there, um, but it's also just kind of a situation comedy, and Kominsky method was the one I was trying to think of, which again, hilariously funny and funny things about aging, but also it's not the main storyline. So that's one thing we try to get across to TV storytellers is that you don't have to have the very special episode of, mom was diagnosed with Alzheimer's and now we have all these decisions to make. It can just be part of the character's world. In fact, there's a show called, can you tell I watch a lot of TV? There's a show called Resident Alien, which is a cute little sci-fi show. It's kind of it's just a small town, and there happens to be an alien that lives there too, and he's sort of learning what it's like to be human, etc. And just one of the characters, the sheriff of the town, takes care of his dad. And so whenever you see the sheriff, he has his dad with him. His dad has the little oxygen thing on, and it's not a story about how the sheriff takes care of his dad. That's just one of the characters. So integrating that can almost be more powerful than the very special episode because it's integrated into the world and the life of your characters on your show, and it's just part of life. And so we're hoping to see more of that as well, and less of the, the joke about, the grandma with dementia or something. So, and I think, again, I think we're making progress. And I think the biggest barrier to depictions of older adults on television in particular is the executives who still are thinking in 1960s and 70s and thinking that audiences don't want to see that. And yet we have seen from our research over and over again that actually audiences want to see that. They want to see things that reflect their own lives. They don't want everything to be all perfect and everybody on TV is wealthy and, all of that. They want to see the true grit of real life, and that includes caregiving and end of life and all these other things. And over again, we hear that from our research. So little by little, we're chipping away at the executives who think audiences don't want to see this and tend to go with the 25-year-old starlet.
Right. And going to that point, Kate, way more about this than I do, I'm sure, but a famous example of changing culture was the designated driver campaign, where they didn't do individual episodes, but they got, like Cheers had a poster on said the designated driver is the life of the party, right? So they just sort of snuck it in here and there. And just if you're counting two other movies, Thelma, starring, which is a film, June Squibb, who's I think 95, and it is actually an elder abuse defeated theme where where somebody financially exploits her. And the other one is The Mole Agent, which is an Argentinian documentary about an 85-year-old man who goes undercover into a nursing home and investigates. So
that's what A Man on the Inside is based on.
Oh,
So
I didn't
Ted
know. Oh, okay.
Danson goes undercover in a care home. Somebody in the chat mentioned about the older we get, the less we are heard. And boy, I can tell you, just as an older woman, it's already happening. But there was an episode on Grace and Frankie that they addressed exactly that, where Grace and Frankie are at the grocery store and they're trying to get the checker's attention. And the checker's talking to some young woman or something, and literally they're jumping. I mean, they of course exaggerated it, but they're jumping up and down and they're screaming and shouting, and these people are talking like they don't exist. And so, yeah, that's something that that we've worked with shows on to sort of, point out. Another one was, just I think Dr. Mosqueda was talking about how, there's a lot of heterogeneity in older adults. And, I can tell you from personal experience with Norman Lear, who again lived to be 101, when he was in his 90s and people would try to take his arm and help him up the step, and he would be like, "Don't help me," and then yet there's the other side of the spectrum. So we did some storylines around that as well on various shows. So we're getting there little by little.
Yeah,
I think,
go ahead.
You go.
Along those lines, I think, and Laura was sort of tilting at this, is that one kind of really stark segregation that we don't even see is the segregation by age. So predominantly older people either live alone in their own homes or in congregate settings together with other old people. And we've really lost many, many opportunities at intergenerationality in all kinds of aspects of society. And I think there's a real toll about it of that segregation in terms of the othering. I mean, the American Geriatric Society did a study a few years ago showing that people who had positive experiences with older adults early in life, not necessarily grandparents, were more likely to go into geriatrics. And we have we have somebody who proves the rule here on this Zoom, but and many other people. But I think we don't even see what's lost by that kind of segregation. And I think that is, and we just accept it as part of the culture. And it's a really important aspect of aging that we need to do a better job with.
Yeah, that's and there are a lot of intergenerational programs now. I mean, talk about a great setup for either a drama or a dramedy or a whatever, to have intergenerational programs. It's incredible. And it is true, if you get a bunch of geriatricians together, we're much more likely to talk about parents and grandparents than our kids, because that's part of the gig. The other thing I was going to mention is the opportunity, I think, to help older adults through the media with our own aging and what that could look like. One area where I'm particularly interested in, we're always talking about caregiving and the stress of caregiving and the burdens and the blah, blah, blah. But if you ask most people, would you rather be a caregiver or a care receiver? They want to be a caregiver. And I think there's a lot to explore in terms of being a gracious care receiver and what that looks like and how that influences your care and how it influences how you navigate through illness or whatever it may be. But this concept of gracious caregiving is very interesting to me, and I think relatively unexplored. And that's just my own term. I don't know if it's a real term.
So how do we promote more information and better information from care recipients and caregivers about storytelling or effective storytelling?
I think, first of all, caregivers tend not to self-identify as caregivers. So in order for us to get these stories out, we have to help them understand that their role as a spouse or a sibling or as a close friend, and when they're providing this care, is something that is called caregiving. That doesn't mean that you are less loving to the person when you use that term caregiver, because in many cultures, there isn't, caregiving isn't a term. It's just what we do for, like what I did for my grandmother, or how I care for my mom. And I've had many conversations with people, and they're telling me their story, and I go, "Oh, you're a caregiver." And they go, "Oh, no, 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 I'm not a caregiver. That's somebody, that's if I paid them, then that's the caregiver." And I go, well, you're doing that. You're worried, you're concerned, you help coordinate things. And for if you don't want to become isolated and you want to find others like you might can be a daughter and you can be a caregiver. So I think that that's one of the things that if we can help people self-identify and not feel that the term caregiver is offensive because it separates us in some way, seems like we're less than loving and giving in when we have the role, if we call ourselves a caregiver too. So I don't know where I was going with this. Obviously, I've forgotten at this point. But anyway, I just want to put that out there.
So that's good to know. I mean, that's good to know for me when I talk to writers even if we can change the understanding of what the word caregiver means and couch it in a positive way instead of, and there again, I can list off shows. Bob Hart's Abishola was a great show that was about a caregiver. Um, so they're there, but few and far between. But definitely, that's something that again is nuance, where it's just taking that word and giving it a new understanding, a new tone.
Thanks, Kate. And I know MTU and Dr. M, you both done work at the intersection of caregiving and elder abuse, and Donna, you have as well. MT, could you talk a little bit about the findings from your research and how that impacts perhaps better practices? Oh, you're muted.
Sorry about that. I think maybe it's worth starting with a practical kind of complication in terms of the messaging. And so early on, the message that I heard in the elder justice field was that most people who abuse older adults are caregivers, right? Or are family members. And we wondered why the caregiving field didn't want to play with us and didn't want to collaborate with us. It really wasn't that mysterious. It's hard enough to get support for caregivers. Most caregivers are doing just unbelievably hard and important and life-saving and life-changing work. And so I think that was something as a field we really needed to shift and be much more aware of and think about how to honor caregivers and also think about how to talk about it in a way that was both truthful and respectful. And so that is, I think I don't think we've arrived yet, but I think we've made a good amount of progress. And Donna, you're going to speak to this in a much more informed way than I am. And maybe I have ideas about the research, but maybe just on that point, I'd love to hear your thoughts, because it's always concerned me.
Yeah. Well, I think part of it, as you pointed out, is when we say that that's where the majority of mistreatment occurs, what are we providing for family caregivers to help support them and prevent any of these abuse issues? And there's that, I mean, there aren't very many good supports for family caregivers. You alluded to the coach program, and that's wonderful. And, if we can replicate it, that would be good. But part of the reluctance of those of us who are helping family caregivers is that APS is not a supportive adult protective services. They weren't providing support. That's just a punitive way to help family caregivers. It certainly is good there for protection. And I'm never saying that, you don't do reporting, because it's absolutely necessary and you want to give people dignity, respect, and safety. But if we don't have a social support system to help, where you don't have to get all the way maybe to APS, and you can actually teach people and educate people, so that that when your relative is at home, you can't just let them stay in bed and because they could get a bed sore, or that this is a different way of, like, they may be more thirsty and they may not have liked to drink water before. And as much as you want to respect the fact that your mom is saying, hey, no, I don't want any water, she's going to have to drink more water than she did before because she's taking a certain medication, or it's, her body has changed. And some of the, I've always said, like, there's abuse, neglect, and sometimes it comes out of respect. And in some cultures that we don't intervene because we want to keep that autonomy for the older adult. And so it's always a balancing act of how much can you help with respect, and then how do you continue to make choices that are good for safety, even when you're trying to respect the fact that the older adult may not be making good choices for themselves. So. And
yes, I mean, I think I see the role of APS a little bit differently. I wouldn't characterize it as a punitive role so
well,
much as
that's changed, but
yeah, no, as a
people think of
narrow
it that way.
one, like from a structural perspective, APS in most places takes reports, does investigations, and often does some sort of crisis intervention. And some programs do more than that, but that's sort of where most of our resources and attention as a society have gone when we think about elder justice. What we haven't thought about, and what's often beyond APS's purview, is how to think about prevention, like the coach program, if we're helping caregivers, or there are maybe other things we can do. And also what comes after APS has to close the case, which is often 30 to 60 days. And that is another huge gap in terms of building social support. A program that I've been involved with called Rise really comes out of, in large part, stories of older people and caregivers. People saying, a lot of older people who are at risk or who are victimized in some way, they don't want help. The top priority is not to get help for themselves, but for somebody they care about, right? Maybe they have a daughter with mental illness, or a son with or a grandson with some substance use problems. And that is the top priority, and is often structurally not something that APS can handle. But that is information for us that has come mostly by stories and listening to people, asking them. I mean, the radical act of actually asking people what they want and then trying to do it, that's like not something that we specialize in generally, but we try to do it now and then. But so we tried to build a program around that, and have actually collected evidence that suggests that it really does improve outcomes significantly. And that's really exciting to say that storytelling can, and including not only older people, but also their caregivers, including both exemplary ones and flawed ones. We want to know, we want to have our efforts informed by what people really want and need.
Yeah, and that's that.
Them, not what we think they want and need, but ask them.
Right, that's a restorative justice model of bringing people together to find out what do they want, how do they want to handle a situation that may not have that may have gone the wrong way in the family. But as you said, some of the care receivers, they don't want to harm their daughter or their son or their close relative. They want help for them, and that's when you can use this restorative justice model.
Yeah, I wanted to mention there was another study done on This Is Us by University of Pittsburgh on there's a whole dialogue between the brothers. One has one point of view about how to care for their mother, and one has another point of view, and they have a big argument about it. It goes on. And, we again looked at what that did to audiences, and it inspired them all. It wasn't like they took a side, but we did ask them, do you agree with this one or that one? And it was about evenly split, but it was more about how they were able to see this dialogue being modeled. And then they were able to go and have that dialogue in their own family about, either someone that they were caring for already, or someone that, in the future they may need to care for. So again, just modeling this stuff. And you don't have to come up with the perfect answer, but just showing people dialoguing about these things can then create people in their own lives to do the same thing.
Yeah, doing advanced care planning.
Somebody in the chat mentions the show Getting On, which we worked on too, and it was a delight. And I'm sorry that it's no longer on the air, but if you can find it, it's really a sweet show about older, a sort of a long-term ward at a hospital. And actually, well, there's lots of older actors that make cameos, and it's really funny and sweet.
Well, while we're modeling these different depictions and different issues that arise, is there one thing that you think storytellers should know about caregiving or elder abuse?
Oh, there's way more than one thing. But I mean, I'm really, I'm, I'm encouraged or heartened. I don't know if that's the right word, but I really want to get to them about elder abuse in general, just because we have not seen those stories. And I think there's a lot we could do with a variety of TV genres. It doesn't have to be a medical show or a, family show. It can be many different things. So that whole issue, I think, is gone unexplored, and there's lots of stories to be told. And one thing I wanted to mention was when we go and talk to writers, we often, we bring in experts on whatever the subject matter is that we're talking to the writers about, but we often also bring in people with lived experience so that they can talk from their own personal perspective, whatever the topic is. If it's somebody who's a cancer survivor, whatever it is, we'll bring them in. And writers eat that stuff up. I mean, they love to hear real people tell their true stories. And it really helps them to then think about their characters and the nature of their show and how they might be able to integrate the subject into their shows. So we do that a lot. So if you got any in addition to the experts on this panel, whom I'm all going to call upon next time I go into a writer's room, but also if there are people who are willing to come and share their stories. We sometimes work with the Motion Picture Television Home out in Calabasas, because those older adults that are there come from the entertainment industry, so they kind of know storytelling and they know what writers are looking for. And so we've called upon them sometimes to come in and talk to writers. But that's something that's really, really valuable for writers to hear, is personal stories.
Well, there's no shortage of expertise. Certainly, the panelists here have so much expertise and ideas, and definitely can advise and help support whatever projects that your writers are working on. But we're turning for a second to providers, because there are a number of providers who are in the audience. What can we do? What can providers do to better support caregivers to ensure that they are being heard, respected, and that they receive the resources that they need?
Well, I think, as we've been saying a lot, is providers need to identify the caregivers in their midst. That's when I'm watching TV or something, I often think of myself, and this is a spoiler warning for The Sixth Sense, where they say, the child says, "I see dead people." I see caregivers. And so I'm always, like, oh, look, oh, that's a caregiver, that's a caregiver. And if we can get agencies to find and start seeing family caregivers and seeing the roles, like what they're doing. And so you can begin to educate yourself as a social service agency, or what are the tasks that people do that then you can rethink of as a caregiver. So that's one thing. And then when you see that caregiver, asking them, what would they like? What's going on? What do they need? Beside what they're generally calling about, which is the person they're caring for. When you ask them, how are you doing? You'll get, and sometimes we don't want to hear the story because we know it's going to take a little bit of time. But giving your staff the time to ask that question, knowing that you're going to get a floodgate of responses, and then having those resources on hand that will be helpful for that caregiver once you let them express their joys and frustrations.
Thank you. Do any of the panelists want to add anything to that
Sure.
question?
Well, just on a practical level, I think in a medical office that caregiving should be a diagnosis. Because many times the physician who's caring for the older adult is not also caring for the caregiver.
Mm.
And so whoever that caregiver goes to for their primary care may have no clue that they're a caregiver and what's involved in that.
Mhm.
Um, so that's just a very practical kind of thing. And then the other thing that I think people like myself need to do is to just be quiet and listen and invite people to tell us what's going on. And we have to listen with our whole bodies. It can't just be listening with our ears. I mean, we have to really be attentive. It can't be a hand on the door kind of a listen. It has to be sitting down eye to eye with somebody in an appropriate setting, in a very calm setting. And we have to listen with our ears and our eyes and our hearts and our guts and, our whole body. Um, and and then we need to ask the question, sounds like a really hard thing you're going through. Have you ever hit your mom? Are you worried that you might hit her someday? But we have to provide the safety and space for people to answer those sorts of questions.
And having shadowed Laura, it's a very moving thing, and asking questions that almost no one asks, um, and giving room for it, but also, not that anybody wants to hear lawyers on medicine, but um, it isn't just the diagnosis part, Laura. Even if caregiving isn't a diagnosis, just asking, like if a person comes into the office, just asking them, because caregiving, the data are just astonishing to me, that it increases mortality by 63%, that increases rates of heart disease, stroke, anxiety, depression, all the things. It has a huge impact on health, caregiving
Right.
does. And so doctors should be asking about it. It's comparable to, do you smoke? How much do you exercise? What's your diet? What's your sleep? And we're not doing that. We're not honoring what is the fact of existence for tens of millions of people. And so I think just that kind of norm changing, even if we don't call it something, just asking about it and then opening the door to the follow-up questions that Laura was talking about.
And in the medical system, the one advantage of, and I don't mean to over medicalize it, so I love the point you just made. The advantage in a healthcare system of putting it down as a diagnosis is then it gets on, it's just a super practical thing. It gets on the chart, and then wherever this person goes, that's on their quote problem list, even though it's far, far from a perfect solution. But your point is very well taken, MT.
And what a great way to wrap up this webinar with a very thoughtful discussion and guidance. I would like to go around and ask each of you to please provide, if you could, one resource um, to assist the audience, whether it's a media resource or a guide or a book or something that would be helpful. And I invite the audience to do the same, to put in the chat information that they think could be helpful to all of us. So who'd like to begin?
Well, I'll start. I mean, and this is not because I'm a character in her book. I'm one of many characters in her book. But The Measure of Our Age, and it's hard to put on the screen, but I'll put it in the chat. It's really brilliantly written, and it's very moving, and it has a lot of information. I learned a lot from
Mhm.
it, and so that's what I would recommend.
I definitely second that recommendation. MT?
Um, well, thank you. It's a little embarrassing. Um, I would recommend The People Say, which is a compendium of voices of older people, compiled by the Public Policy Lab, and with support from the SCAN Foundation, which has thousands of they interviewed a jillion is sort of a technical number, I think. I can't remember how many people they interviewed, but a lot, and then broke the interviews into thousands of bits and have sorted them in different ways. Because one of the challenges in advocating in this space is that we often don't have the voices of the people on behalf of whom we're advocating. And so there are a lot of, you can put in caregiving, you can put in financial exploitation, you can put in all kinds of different stuff, and then get clips that relate to um, those particular issues and real people's voices. So I think that it's a tremendous resource. And I just want to, we feel like we're failing at aging and failing at caregiving when in fact we're being failed by society and we somehow have to shift that frame. And so I think this helps.
Yeah.
Thank you. Donna?
I'm going to go with something like from AARP. They have something called Caring for Your Parents, a complete family guide. Anything and I just love that the shelves are having more and more books on very practical things to help family caregivers from the early stages all the way through late stages. So any guide that you can go and read. Of course, when you're on the internet, you can also look within any of the disease organizations, like on Alzheimer's Association, Parkinson's, IDD organizations. And that's really where you can begin to find resources and support groups. I'm sorry, I know I was supposed to say one thing, but support groups are really, really great. And you can find them on Instagram. You can, try out several support groups because I think that's always very, very helpful.
Thank you so much. And Kate?
I put in the chat a link to our page on hollywoodhealthandsociety.org, Rethink Aging. And there's lots of resources and short videos that we've made. The 3 short videos we made actually were for the SCAN Foundation, and we've worked with them for many, many years on this issue. So SCAN Foundation also is a great resource. And then I just have to give a shout out because this is something we didn't really talk specifically about, but there's a term which I learned from a friend of mine who made a short film about granny dumping. And so she has a short film, it's called Severio, and it's about, people take their elderly that they can't take care of anymore and they just dump them or they leave them at the hospital. And this is a phenomenon that I hadn't learned about until I saw her film. And it's something, again, that was touched upon on the pit. But that's another area that I think we need to dive into in more detail.
Well, thank you all so much for participating in this webinar and this thoughtful conversation to celebrate Family Caregivers Month. And now I think we'll see some slides about the NCA's materials. Thank you. On caregiving, including tips and tools for safe and supportive caregiving. You can learn more about our presenters and their work by visiting their websites. We would very much appreciate your feedback. A survey link will be placed in the chat. Please click on it to provide your comments about today's webinar. And in addition, after the webinar, you will receive a follow-up email with a link to a recording of today's webinar and the survey. If you have any questions, please feel free to reach out to us at the National Center on Elder Abuse. Our contact information is on the slide. And on behalf of the NCA, we thank all of our presenters and we thank you for joining us today. Have a great rest of your day.